Hello, good afternoon. Thank you for joining our workshop today. Before we start our presentation on the role of cultural brokers in supporting immigrant and refugee communities in the time of COVID-19, we would like to acknowledge the territories where we are at. We are at this moment from west to east. But I am East, I'm Sara Torres, and I am located at Laurentian University, and our territory is the territory of the Atikamekw and Anishinaabe peoples. And my colleague Tracy Robinson from Manitoba Possible, the territory is the Treaty 1 territory, the traditional territory of Anishinaabe, Cree, Oji-Cree, Dakota, and the homeland of the Métis people. As my colleague Meiji Chang is with the Multicultural Brokers CoOp located in Alberta. As you can see on the screen, is the territory of various indigenous lands, including the Cree people, the Blackfoot, Métis, Nakota, Sioux, Iroquois, the Den and Ojibwe, and the Saulteaux, Anishinaabe, and Inuit peoples. And my colleague Esther C. from Umbrella CoOp. She's located in the New Westminster, British Columbia, the traditional around-sea territory of the Kwaikwe and coastal Salish people. So thank you for joining us. It is important for us to recognize the territories and for you to recognize the territories where you are as well as part of developing better and more equitable relationships with our indigenous populations. And before we start, I guess the conference organizers have asked us to remind you that you can submit all your questions via the app called Slido, and that the code for the conference is P2P 2020. So please send us your questions, and we will be more than happy to organize a separate Zoom after the conference if you are willing to do so. So let me know, let us know. And for now, I'm pleased to start our presentations with colleagues here and give you an overview of the models that we have, that the Community Health Worker Network and its members have across the countries, and how we are helping immigrant refugee communities at this important time. Okay, well, now, Tracy, I'm gonna ask you to share the presentation and share us all the work that you're doing in Manitoba.
Hello everyone, so my name is Tracy Robertson. I work at Manitoba Possible, which is a disability support organisation in Manitoba. We were formerly called Society for Manitobans with Disabilities, and like many people, we have certainly had our challenges during this COVID-19 crisis. Before I get to that, I'd like to be able to provide you with some information about our organisation. So we are Manitoba Possible. We believe in an inclusive and accessible society is possible, and that's why we work together to eliminate barriers to full and equal participation. I won't go through the list, but this is some of the services that we provide in Manitoba. There are many, many other programs beneath these headings as well, and we're quite a holistic service. The Newcomer Navigation and Support Program, which is the program that I manage at Manitoba Possible, was established in 1997. It's formerly known as the Ethno-Cultural Program. We're actually based on cultural brokering. That's the foundation of our program, and we work with newcomers with disabilities whose first language is not English. The next sentence is highly oversimplified. We assist clients to navigate the various systems and sectors available to support them. Just rolls off the tongue. In reality, it's such a complex process, and there are many, many different intersecting sectors that we work with on a daily basis. And so if anybody wants any more information of how complex that is, my email will be at the end of this presentation. Currently, our team is made up of 9 cultural resource facilitators, and we currently have 23 languages spoken in the program. That changes according to diaspora and need, and has changed over the years, although our team of cultural resource facilitators are long-term members of the program, which is vitally important when you're working with communities, that we have long-term members of the team. I'll get to that a little bit later. So Who or what's a cultural broker? Well, Jazuski's kind of the Jedi of cultural brokering, and he defines cultural brokering as the act of bridging, linking, or mediating between groups of or persons of differing cultural backgrounds for the purpose of reducing conflict or producing change. And a cultural broker also acts as a go-between, a one who advocates on behalf of another individual or group. Now, this information was taken from Georgetown University's guide on cultural brokering, which I would encourage you to go and look up and read. It gives much more information on the roles of cultural brokers. Basically, the essential roles of cultural brokers is that they must speak the language and understand the culture of the community that they serve. They work embedded in their communities. They are able to fluently speak the language or languages of their community they serve, and they understand and interpret intricate customs and beliefs. They're highly skilled communicators and are in good standing in their communities. That's vitally important. The challenges to our work during COVID-19 were our clients, well, I've got them listed here, I'll go through them. Our clients' responses to COVID and the shutdown. Although many of our clients were able to process what was actually happening, but some of our clients and individuals and families, the pattern of government's daily press conferences, telling people to stay home, businesses closing, streets were empty. We had one client actually say, this is eerily familiar to what happened before the conflict in my country. And we actually had a couple of our clients have fairly strong PTSD and panic episodes. Working remotely, the challenges for our clients and our service providers and our team, our work increased exponentially. It was very challenging because most of our clients found the challenge of working with technology too much. In the beginning, many of them didn't want to use the technology. They still wanted to see us in person. So in addition to fielding phone calls constantly, we were also in the position of going out and having meetings on people's driveways, parking lots, backyards, etc. And you know, when this originally started, it wasn't the greatest weather. It was in the springtime, so that was quite challenging. The education sector, 2/3 of our clients are children or youth. And so our team became experts in the technology being used by schools overnight. The schools contact us to be able to make sure that messaging is getting to the parents, usually in our work, and where that person that facilitates that communication. And so, you know, we had all the phone calls about homework. We had to figure out how to use all the different software and the different school divisions and the different policies. Schools also made assumptions about tasks that they could give to children to do. So we had, you know, phone calls about what is Lego, what is Play-Doh, how am I supposed to get this? You know, people on low incomes, it was difficult for them. The disability and health sector, day programs closed. There were critical appointments that were cancelled, that people had been on waiting lists for a long time. All of a sudden you had individuals who'd been in day programs and had families had a lot of assistance caring for people. Now they didn't have that assistance, and so you had some parents with adult children with quite challenging neurological disabilities who are now at home with them 24/7, and that was quite problematic. And so lots and lots of phone calls and discussions with our clients and service providers about how we could mitigate that and help with that. Daily living challenges, as I said, there was no programs. There was also significant food insecurity, Many of our clients don't have credit cards. You know, they were unable to arrange for some of their essential supplies to be provided. And so our cultural brokers then ended up being shoppers, you know, dropping emergency groceries off, emergency medical prescriptions, because they weren't able to arrange for those prescriptions to be picked up themselves. So they had to formulate all of that for them as well. Our work increased exponentially. All of the service providers needed to talk to us so that they could pass messages to the clients, and the clients called our team really 24/7 during this time to sometimes just to have their minds put at rest about what was going on, I'd be able to talk through what was happening to them. On a final note, I'll just say there's been a very able-orientated and middle-class approach to this pandemic, where it is assumed that you can have groceries delivered and that, you know, children will just stay home, and the 2.5, you know, in the, you know, the nuclear family of 2.5 kids and a dog, and everybody's going to be good. They're all going to have the technology, be able to do everything from home. We have had a considerable amount of work finding gaps that we had to work really hard to fill to make sure that our clients didn't fall through them. And because they are cultural brokers and had such a close relationship with the families, they were able to do that. I'm going to end here, and my colleagues who are also presenting on this panel have more information on cultural brokerage and how it pertains to their programming, and hopefully that will give you a fuller picture of what we do. Thank you.
So I'm going to build on what Tracy shared and hopefully ground a little bit into the practice of cultural brokering. But first of all, I'm just going to say a little bit about the Multicultural Health Brokers. This organization that I work for, they were one of the early pioneers of health brokering. So we were established 25 years ago, and we established as a cooperative. And I think when we first established, there's probably about a handful, maybe 10 women who actually were the founders of the Multicultural Health Brokers Cooperative. But right now, there are, I think, over 95 to 100 cultural brokers. So it's quite a huge organization, and it represents over 20 ethno-cultural communities in Edmonton. So we work in multiple areas. We work in health, we work in schools, child protection, work with government agencies, and we also work in multiple roles. So we know we're helping to navigate systems, advocacy, systemic change, community building, lots of prevention work, and addressing community needs. So I want to move on to actually describing some work that we did during this period. So Tracy already mentioned a lot of the things that we had to do, which was like helping clients get on Zoom, helping groceries, all of those things. But I want to focus on one particular area, and I'm going to see if I can share my screen right now and bring up my presentation. So really what I wanted to present is a very grassroots community response to the mental health crisis during this time. Because one of the things that, you know, Tracy already mentioned, you know, a lot of our clients are from refugee immigrant communities, and, you know, there's triggering of trauma, there's isolation, there's a huge amount of anxiety during this time. So one of the things that came up over and over again was mental health. So very early on, we organized ourselves into like conduit groups where we disseminated information. So there were about 10 groups where we were like conduits of information in the CoOp. And each of those groups were represented by somebody, and there was a core conduit group. And in this group, you know, we were hearing over and over again this thing of mental health and how that was coming up more and more. And then this one particular example came up, and it was from Stephanie, who works in the Filipino community. And she was leading a parenting group. And she was saying that, you know, usually they talk about parenting, but more and more they were finding that people were disclosing very personal issues, probably because this was the only forum they had. And they were starting to share very personal challenges and their personal distress. So she had this question, which I wrote down. I don't know whether I'm overstepping my role as a broker. I'm not a mental health professional. So I work as a psychotherapist, that's my background. So when I heard this, I said, you know, I'll take this to my colleagues. So we have about 95 brokers or so at the CoOp, but we have 4 therapists that work with the brokers. So I took it to a therapist and we had a discussion to talk about this. So, you know, what is the line between a broker and a therapist? And where the conversation took us was that, you know, in therapy, no matter what modality you use, whether, you know, it's something like cognitive behavioral therapy, or whether it's, you know, person-centered, what we know is that the key ingredient for a successful outcome is actually the relationship. So the therapeutic relationship. And the strength of the therapeutic alliance. So when we got to the conversation about that, we were looking at, okay, what makes a relationship therapeutic? And we started talking about the ingredients of transformative relationships. So taking it out of any particular professional in a profession, what makes a relationship actually transformative? So what are the magical ingredients of that? So that's where our conversation went to. And we ended up designing a workshop, you know, for a couple of weeks later. And that was for the core group, for the core conduit group of about 10 women. And this is really what the workshop focused on. So we've all experienced transformative relationships, you know, whether it's a teacher, a parent, a mentor, a pet, you know, whatever it is, we know what that feels like. But can we be conscious of what are the magical ingredients that really make that relationship transformative and supportive, and how it changes us and strengthens us? So that was the discussion. And, you know, so we built this workshop around this discussion. And we ended up taking this workshop to all the brokers in the CoOp. And really, when we have workshops, we want them to be participatory. We want to actually find the knowledge that people have within their own communities and their own wisdom. So the things that came up over and over again was like, you know, they were sharing relationships, whether it was a parent or a friend, or when they first came to Canada. And so much of it was about just, you know, being present, being there, deep listening, having the feelings validated, having a focus and strengths, being empowered. And one of the most central things that was spoken about over and over again was the ability for the other person, that person, to tolerate feelings of helplessness, because often it was situations where we can't fix it instantly. You know, if you think about, you know, the pandemic, people being locked up at home, all the issues they're dealing with, it's not like an instant fix. So a lot of it was being able to tolerate feelings of helplessness, feeling stuck, not being able to fix the situation, and yet still be present for the other person. And the power of just not being, you know, to be there for somebody else so they're not alone, and how powerful that is in terms of support for mental health. So a lot of this was shared human experience. And we started talking about how do we develop language that's supportive, empathetic, empowering. So I'm not sure about the time, so I'm going to try and speed myself up a little bit. And so this was the conversation, and we found it to be very, very powerful, just to look at what it is that really, really supports mental health and what transforms us. And this is something that I shared later with the therapist as well, when we continued this conversation. This was actually a training that I took. It's the Alberta Family Wellness Initiative. And it's by, the slide was shared by Torres, who is an elder of the Mohican Nation. And what I really loved about this slide was that he was showing how mental health is really, ideally, comes from an ecosystem that's healthy. So he was saying that, you know, before his communities got broken up, that they were healthy ecosystems, that we didn't have mental health professionals, there were no social workers. And he was actually saying to, you know, this room full of social workers and therapists that you wouldn't have work if this was, you know, if this was the case, because this is how mental health actually looks in a natural system. And I really love that, because I feel like that's what cultural brokers do. They build up the natural system. They build up cultural values. They respect their elders' teachings. They're building up interconnectedness. So that's what they actually do. And so I'm just going to kick forward a little bit. So I'm just going to make conscious really the process that I've just taken us through. So first of all, the issue was flagged by a member of the community, by Stephanie, who was working with Parenting Group. So often cultural brokering, the issues are emergent. It's not top down, it's really grassroots up. The issue was brought to me as a therapist because I was just one of the knowledge holders that's working at the CoOp. Okay, so I go and I work with other colleagues to explore the issue. And we discovered that relationship is really a key ingredient for mental health support. We then design a participatory workshop that identifies what we're looking at. What are the magical ingredients of transformative relationships? The workshop is then rolled out. We test it on a group of senior cultural brokers. And then a week later, a couple of weeks later, we incorporated in a 4-hour workshop for all brokers to support them to support their clients' mental health. And then the learning and the feedback from the workshop informed our mental health strategy moving forward. We began to rethink our mental health strategy from, therapists as the core mental health supports for brokers, this kind of one-on-one kind of thinking, to moving into the idea of like this ecosystem where brokers and therapists work more seamlessly to provide mental health support for clients, and that the brokers are actually empowered to become conscious of what they're already doing in terms of supporting their communities in terms of mental health support. And we're beginning to think of the therapists as working and supporting the brokers to do this work. So if the brokers have issues, they can actually refer to us for supports. So moving away from just that one-to-one kind of system to a more ecosystem. So I think that's it. I hope that helped ground it into a practice.
Yeah, that was very good. Thank you so much for explaining how you do the work in Edmonton, the cultural brokers do the work, and the relationship with therapists. That's very good. Thank you so much. Okay, well, now we're going to continue going west, and it's our colleague Esther C. from the Umbrella CoOp in New Minster.
Hello, good morning, afternoon, everyone, wherever you are. I am Esther Sia. I'm from the Umbrella Multicultural Health Co-op, and it's my pleasure to be here on this panel with my most esteemed colleagues, and together also with you folks, even though we can't see you, not yet anyways. All right, I am going to put my screen up. Yeah, carrying on with building on everything that both Tracy and Mechi said, I'll just give you a quick introduction into who we are, the Umbrella Co-op. And we are a community health center that's based in New Westminster, British Columbia. And as Sarah has mentioned, that this is on the ancestral lands of the Kikite and the Salish Coast First Nations people. And we provide health services for racialized ethnocultural immigrant communities. And so how, as Tracy has described what a cultural broker is, and Mechi has given some details on the specific role, well, both of them, on the roles that they play within their organizations. And so at Umbrella Co-op, within the community health center, the cultural broker is also plays a central role to our services. So a community health center is an interdisciplinary team working together to provide primary healthcare services. And different community health centers look differently. So I'll just give you a quick overview of what Umbrella Co-op looks like. And we have a family practice and a pediatric clinic. And both of these services are supported by our social determinants of health program. And we also have health promotion programs to address upstream health and wellness. And we also have social circles. These are community groups that are led by volunteers within the community to address mental health and isolation in a community setting. And as I said, that the access to all of these programs, the heart of our organization is the cultural broker. And so this has the specific application of it being embedded in the healthcare setting. So bridging those cultural and language gaps within the primary healthcare setting. So the patient accesses all of these community health services through our cultural brokers. So in regards to the pandemic, and really building on what my colleagues have said, is, as I said, the heart of our organization and our service deliverers are cultural brokers, and certainly the heart of our response to the pandemic laid within our cultural brokers, our cultural health brokers, and specifically the trusting and long-term relationships that the cultural health brokers hold with our patients as individuals, their families, and the wider community. And I'll just give you a brief overview of what that looked like for us as a community health center, and the invaluable role that the cultural brokers played in engaging our communities in the response. So on March 17th, that's when in British Columbia, a state of emergency was declared and the pandemic was declared. And so what we very quickly realized was, you know, in addition to us ourselves not really knowing what that meant and figuring it out as quickly as we could, what we discovered is that there was very little information, especially at the beginning, for people who did not speak English or French. That the information that they were receiving, there was a big information gap. Many of our patients didn't know what COVID-19 was. So the first thing we did was do one-to-one health promotion. So basically that was each of the cultural brokers picking up the phone and calling each one of their patients to check in with them about how they were doing, and then to provide just the basic information about what COVID-19 was, what the pandemic response was, and already start training them on some of the tools that were being created in British Columbia. For example, we had a self-assessment tool that was created by the province, so people who were experiencing symptoms could access that. So they did this on one-to-one so that it was tailored to meet the needs of the patient, so that all of them, that we could bring up the equity in terms of participation and understanding and engagement in the pandemic. So that was the first couple of weeks of our work in March. And then what we also, the second thing that we realized as we kind of got ourselves oriented into what the pandemic was that people weren't getting sick from COVID, people were losing their jobs. So that was the next thing that was identified, was the social determinants of health needs. So then our coordinator, she, like everyone else, and like all of you people, my colleagues and you folks listening to this, everyone kicked it into high gear. And she did a massive training program for our cultural brokers in terms of how to access the serve. That was probably our number one service delivery, was supporting our patients to access the serve. Again, as was mentioned by Tracy, food security, that was another issue. And of course, housing, right? The threat of losing being evicted and not paying rent. So then our cultural brokers were able to support our patients to advocate and to access all of those programs and services that were being in place to protect them. And then as we moved further into the pandemic, we also recognize, and to this day, that the communication gap still exists for non-English and non-French speakers. There's still a really big communication gap, not only for language, but also that cultural interpretation. So what we have been doing, and this was since the beginning, was also providing public health updates. So we have a nurse as one of our staff members who also has a background in public health, who is taking all of the regular updates that we're receiving here in British Columbia and synthesizing them and creating summaries that are targeted towards our patients. And this has been ongoing throughout the pandemic, and it was very intense at the beginning. And then once again, we're increasing the intensity of this as we are experiencing the second wave. And then, of course, underlying all of this, as all of you know, is going virtual. So people still have regular health needs, whether it's COVID related or not. People still need to see their doctor. Right? We do provide an essential service. So then as Tracy has mentioned in her program, there was a whole barrier of technology, and specifically with going virtual clinics to moving clinics from face-to-face to in-person, there was tremendous technology gaps because the platform that is specific, it's a confidential platform for accessing clinical services. It was really buggy. and so our cultural brokers, they spend a lot of time doing the one-on-one training. Again, so patients that required these virtual appointments, spending the time and training them, figuring out what technology did they have, a laptop, a cell phone, and then like, how do you download the platform, and training them on how to access this. So that was also a few weeks of very high intensity training to provide this access. So just sort of in summary, to kind of highlight the value of these cultural brokers and the role that they play within the pandemic, again, highlighting the invaluable role that they play. Underlying is this communication, right? Communication has been key in this pandemic, and that through these trusting relationships that they have, they are able to support these communications so that they can enhance the equitable engagement for non-English speakers, for racialized ethnocultural communities within the pandemic. And I'll leave it there, and I'll pass it back over to Sara to continue the presentation, and looking forward to answering any questions any of you may have in our discussion afterwards.
Thank you so much, Esther. Thank you for very enlightening us what you do in British Columbia. So let me then continue with my presentation. I am just going to do a brief overview of what we're trying to do kind of at the national level. So what we're why we are actually able to do this workshop today, and is because we are trying to work together more across the country. So what we have done in the past, a few years ago, is that we created the Community Health Work Network of Canada, because we know there are many models across Canada doing the cultural brokering. So with my colleagues here, Esther, and colleagues from the CoOp, Mechi, Tracy, we are actively involved in strengthening the network and making sure that we find all other models, other groups that are doing this amazing work across the country, and that we might not know about you, or you might not know about us, but the objective then is to make sure that we connect. And so there are multiple titles, and some of them are the ones that you see on the screen, but also, I mean, Tracy mentioned cultural resource facilitators, which is the one that they use in Winnipeg, and we have other titles that we don't see here, but we know there are out there. And so what we know as what we call health human resources workforce is that cultural brokers or community health workers are a part of what we call a workforce that is on the margin or the periphery of our health and social services systems. So when we look at this, what we said, the social location of cultural brokers, because they are at the periphery of mainstream health and social services, they are on the margins, so they do not receive, most of them, some do. If you are within the healthcare system, you receive better income, better wages, more services. But if you are independent of the healthcare system, and if you're working as an arm's length, then workers might have less security and less benefits because the income is based on projects. So now, as a whole, we want to make sure that we work for the recognition of this workforce, because you had the testimonies of Mechi, Esther, and Tracy about the amazing work that they're doing in their communities with immigrant and refugee communities, making their experience much more kind of dignified in Canada. So then, I mean, I don't need to repeat what my colleagues said, but the opportunities that we have as a network, despite the disadvantage of them as a workforce, is that because the trust that they have with the communities, they have been in a very good position right now to respond to this crisis. They have the trust, the long-term relationship that they have built allow them at this moment to be able to answer questions to families and for families to trust them, for the healthcare system, for the child welfare system, for the school system, to be able to come to call upon cultural brokers to help outreach to immigrant and refugee communities who are experiencing marginalization. So this, in times like this, is when we say, wow, it is indeed worth it. We know it is worth it. But when a crisis like that happens, and we know that cultural brokers are actually helping those communities to break the barriers so families don't fall through the cracks. I mean, they do, many families do, but cultural workers are trying to work with multiple health and social services providers to support communities at this time. So what what we want as a network is continue working in multiple areas of the work. And for example, so one is the actual activities, the programs that we do, but we're also working on doing some research right now because, for example, we want to understand the work that cultural brokers in Edmonton do in negotiating the relationship between immigrant and refugee families and child welfare workers. So that's one of the areas that they work in. So we need to continue the research to be able that we do that. Another part that we want to do is that in future, because I want to make my presentation as short as possible so we have enough time for questions, is that we are, as mentioned, because the position that cultural brokers have within the communities, it gives them that disadvantage of being able to make families feel that they are there to help them. And also, we also need to be thinking on the future. So in the future, as a health and social services workforce, we want to work on the recognition of the workforce, work on bringing other models of cultural brokers across the country together. We also have been able to secure some funding from IRCC, and we're very thankful for that. So in future, we will be working in this project that we have called the Cultural Broker Agents for Health and Wellness, Equity for Newcomers. And we call it along the full continuum of settlement, integration, and social inclusion in Canada. We are conscious that terms like integration has been put into question in a presentation that we heard earlier today by one of the speakers in the plenaries. So we are conscious that indeed, when we talk about integration, we're talking about also respecting the cultural and strengths that communities bring in. And it's how we as Canadians can both learn and create this co-create together based on the relationships that Tracy, Esther, and Mechi mentioned to you. So again, we do thank you for being part of the workshop. We trust that you'll continue working with us, learning about our work, strengthening the connections and supporting what we do, and especially what cultural brokers do across the country. And so we thank all the families, because without the families, we couldn't be doing this work. The network as well, because we are trying to build this work together. And I mean, I am with Laurentian University, so thank you, Laurentian, for giving me the opportunity to be here, and the Social Sciences and Humanities Research Council for the funding we're getting for research, and IRCC for all the support that you're giving to our colleagues. So I'm gonna stop my presentation here, and this is my contact information. But again, once again, so we'll start the questions now. I'm gonna check the app. I think it's called the Slido app, because that's where we're supposed to get all the questions. So I encourage you to send us your questions and about anything that you think you want to know more about that. But in the while Okay, so I do have a question here, and it says, are you government funded or volunteers? I can let one of my colleagues answer. I can go ahead, Tracy.
We are funded. So for ourselves, we receive our core funding from the United Way of Winnipeg. And then we are also funded, substantially funded by IRCC as well, which we're very grateful for. One of the things that you have to be really careful of with cultural brokers, who are also known as navigators, by the way. There's a big push for navigators at the moment, but navigator is another word for cultural broker, and there are actually many cultural brokerage programs out there. It's not a new thing. Navigators certainly aren't new. But one of the things that you do have to be careful of, and I was going to mention in my presentation and I didn't get to it, is that, you know, for when you're looking to actually have someone do this type of work where they're embedded in their communities, you are hiring them because they speak the language, they understand the customs and nuances of that culture. You are hiring a cultural broker. And it's an unfair position to put a volunteer into because of the amount of work that the cultural brokers do and the amount of time it takes up in their personal time, in their personal life. You know, having people volunteer as cultural brokers puts people in a very, very unfair position. So we in our program, at least then, and I'm seeing my colleagues nodding there, but in our program, we don't advocate that that cultural brokers are used in a volunteer capacity, because it's just not good practice in terms of how much of their life that work is going to take up. Thank you.
Okay. Thank you, Tracy. Do Mechi and Esther want to add something, or should I we'll go with the next question?
I could add something, because
yes.
the answer to that question a couple of months ago is really different to the answer I can give today. So Umbrella Co-op has been around for 10 years. And for almost all of those 10 years, up until a couple of months ago, we were funded independently through donations, through grants. And again, you know, what Sara alluded to, that speaks to this really kind of precarious, undervalued employment for such a highly skilled and impactful work as we have described. So we've been doing that for the past 10 years. And recently we did gain the recognition from our province, our Ministry of Health, that the way that we are, our model of delivering primary health care systems to a very difficult population to include equitably within the healthcare system. They have recognized our model, and we have actually just received a significant ongoing funding from them so that we can expand our services. So now I can say we are, as of a few months ago, we will be predominantly government funded.
Okay, thank you.
Yeah, I just want to mention one, I won't go into our funding, but I want to mention into just one thing, is just that the CoOp started in a way with a lot of volunteering. A lot of the brokers start off by volunteering, and in a way they're ongoing volunteers too, because often they're not paid for a lot of the work they do informally. So in that sense, most of the brokers at the CoOp are also volunteers, unfortunately, and that's one of the things we would like to address and have their work be funded properly. Yeah.
Thank you for all your answers. I could also add that one of the challenges, and this is again the benefit of knowing the community and developing trust with the community, is that the community looks up for you on multiple fronts. So let's say cultural broker is being paid for a health promotion project, right? But if the community needs support in another area, let's say like filling up the forms for employment, they might ask the cultural broker to do that. So the cultural brokers, many will not say no, they will support the families in other areas. So that kind of becomes indeed the volunteer work. As much as Tracy said, we don't want to rely on cultural brokers as volunteers. In reality, it does happen a lot. So, but this is why we're advocating for support, enough support so that their work is recognized at multiple levels. Okay, so thank you so much. Now I have another question. I'm going to start with the one question about if someone wants to develop a cultural broker program in an area, how do they go about? Who wants to answer briefly that question?
Well, I can certainly start. I think that at least with our 4 colleagues, one of the things about cultural brokering, and it was mentioned in the in one of the presentations, it's really a grassroots. It's a bottom up. It's a bottom up practice. So usually how it happens, certainly how it happened for Umbrella CoOp, and I know the health brokers in Edmonton, that and a lot of we're recognizing this work within the community health worker network across the nations, is that these brokering happens as a response to a community need. So, I mean, that's usually the seed of the start of a broker program, but beyond that, sort of including the bottom up, the community, that it's a community-led practice, right? Not a top-down program that you're going to implement. And not to get into the minutia, I think that, like Tracy had mentioned, health navigators in the healthcare system, what we see is that is a role that has been created by the health institutions. And what we recognize, there's still a gap. That's why Umbrella CoOp is relevant, because we have used this model of cultural brokering. And beyond that, in terms of the practical, how do you do it? I would encourage everyone to connect with Sara. Sara, who is our fearless leader in our community health network. The 4 of us are collaborators on that. And that is our project that we're working on with the IRC grant starting in 2022, is to standardize this practice, and create these tools where we can better answer those questions. It's like, hey, I have a need to have a cultural brokering program installed. How do I do it? And at the moment, we have a collection of what each one of us has sort of independently created on our own that is housed within the community health network. And Sara, I would encourage people to reach out to Sara for the specific manuals or documents that would support you.
Hey, thank you so much. One way to start as well, for sure, is start with the leaders in the community, yeah, because they truly, I mean, those community leaders are the ones who know exactly what's going on in the communities, and they support them to create initiatives to support the communities, but do get funding for sure to recognize their work, so they're not working on a volunteer basis. Okay, so I'm going to ask, I think we have time for one question. So the other one is, how do you ensure the well-being of cultural brokers? Often they too experience barriers and intersectional discrimination and so on. Would you like to start? Yeah. Would you like to say something?
Yeah. I could say something.
Okay.
And I think a lot of it is just having organizations where the brokers don't feel isolated, and they really have a voice in what they're speaking about. So in the beginning, when I was talking about how we organize in these circles, so it's not like a top-down thing where in our organization, you know, we decide policies and then we kind of spread it all through. Often it's emergent. So this is an organization where cultural brokers have a voice, and they can bring issues from the communities, and that we can actually explore together and implement things. But it's very much drawing on the wisdom of their own communities. So that's my response to that. Maybe Tracy and Esther would have more to share.
It's thank you, Mechi. For us in Winnipeg, we are fortunate that most of our team are long-serving members of the team. And so when someone is onboarded into our program, there's a lot of wisdom that is passed on to them by their colleagues. And along with that goes a lot of support as well, and the opportunity for them to contact one another and to talk about their experiences, because vicarious trauma is a very real issue for cultural brokers. In addition to that, you know, there's also the fact that it's difficult for them to maintain boundaries in their communities. And so their work days sometimes can go on quite a bit. You know, they can be, and that's that volunteer issue that Mechi and Sara and Esther touched upon, with, you know, where they're being paid and oftentimes minimal wages, and oftentimes there are women doing the work. It's gendered and low paid work. You know, so all of these things add to their stress. In Winnipeg, we're very fortunate that we have Aurora Family Therapy Centre, which is funded by ILCC. And there's a project that they have running at the moment where they actually provide sessions for settlement in the settlement sector for frontline workers. And we have taken advantage of that and had a few sessions, including online after COVID became an issue, where the team is able to get together and to go through a process of some sessions with them and help them deal with the stress and that they're under. But as a manager of a program like this, your door always has to be open, and you have to be prepared to listen. You have 2 eyes and 2 ears and 1 mouth for a reason, and that's because you're not supposed to use your mouth so much. So I spend a lot of time trying to be as receptive to my team as possible, because they're the ones out there on the front lines, and their stress at times can be incredible.
Okay. Well, thank you. Okay.
I'll just add one quick note to that, and just to connect the dots with what Mechi and Tracy were saying. It's also that these services need to be embedded within trauma-informed practice, right? So anyone who's thinking of having a program or starting a program, or who has one like that, is really critical, like to acknowledge that, as Tracy's saying, the vicarious trauma, and the person who asked that question knows that they're highly vulnerable to that.
Okay, I have one more question. Okay, if we can do it in 1 minute each, that will appreciate. Oh, there is a big question. Settlement workers also do bridging, linking, and mediating for newcomers and community resources. What is the difference between settlement workers and cultural brokers? So who wants to start?
Okay, I'll say this really clearly. If any organization that is employing someone to work in a position because they speak a particular language or set of languages, and they are from a particular community and understand a particular community, and they will be working with that particular community, whatever the label is that they're giving, you know, you might be a settlement worker or a life skills worker, I don't care what the label is, that organization has hired a cultural broker. And that's how you know that you're a cultural broker.
Okay. Esther?
Yeah, I can add to that. There's all sorts of names for cultural brokers, and I maybe even blurred it when I said navigators, right? That there's sort of nuances between the name. I think the added piece with cultural brokers is there's also an advocacy component, right? There's, as Tracy had shown in the definition, right? There's you're impacting the system change, right? So there's kind of, I think, a scale on where people, like, what is a community health worker, a navigator, settlement worker, and a cultural broker. And I think where you're including that system change component and that advocacy component is really kind of, I guess, more encompassing of cultural brokers. But I think Mechi, I'll let you add as well.
I guess the little bit I would add is just something about the long-term relationships that we find our cultural brokers having with members of the community. So it's not just working on a piece of work, like a settlement piece of work. It's often years and years of ongoing relationships, and that which makes cultural brokering very, very unique in that way. People come back to us over and over and over again. It's not short-term work, it's yeah, over the years, that relationship.
And I think maybe I can just say also that it is the work in multiple sectors, right? Because cultural brokers, as when Esther, you mentioned the social determinants of health, cultural brokers have that vision and have that mandate and that understanding that families have to be supported in a continuum, and that it is not only one area. So someone can be working on immigration, health, settlement, child welfare, I mean, all kinds of areas of needs that the community have. And so they have that possibility to be working with the families in multiple areas. Okay, so, but I know we can continue the discussion. Thank you so much. You raised very good questions. What I'm gonna ask is, I promised those of you who we weren't able to answer the questions today that we will send you a response by email. If you can just send us a note, and I can check after that if I can get your email address via the questions, so that. Yeah, so we will continue, or maybe we'll even invite you to a telephone conversation or something, because the questions that you are asking are very good about the different roles, supervision, training. Oh, it's amazing. Thank you so much for being so attentive and paying so much attention about what we're doing, what cultural brokers do. One word of bye from all of you to say thank you. Any one word, because we're going to be cut off in like 60 seconds.
Just gratitude. Thank you, everybody, for wonderful questions.
Meche?
Thank you for just providing this forum that we can actually have a discussion about this, very unique role of cultural brokering. Yeah.
Thank you. Tracy?
Thank you.
Just as Esther said, gratitude for the opportunity to talk about our work and to highlight the impactful work that our teams are doing on a daily basis, and being able to shine a light on that, because they're the unsung heroes in their communities, and we need to appreciate them and highlight that more.
Okay. Well, thank you again, and please connect with us. And this is just the beginning of the conversation, right? We trust that we'll continue working together. And thank you.